FSDH, we are very happy to be one of the major sponsors and supporters of the healthcare system. So, we're very glad as we'll be discussing around financing the healthcare system. Our goal is to understand what the needs of the sector is and further support them as we go along in the years to come. Thank you.
This gathering here is an example of what government's responsibility is to create an enabling environment for the private sector to flourish in the health sector in Lagos. We are your allies. We can create an environment here in Lagos which already exists, but we need to build its trust level and ensure that people in Nigeria can see Lagos as the destination for advanced medical treatments, thereby creating Lagos as the tourism hub or medical destination for Nigerians and hopefully for West Africans.
Private sector right now is delivering pretty much close to 50% of care for healthcare across the country. We should realize that the PPP opportunity is a major player in any health system. Look at the UK. Almost all the large hospital groups in the UK have been transformed over the last 10-15 years because of PFI funding, which is really private sector money, and PPP arrangements. And so has it been across Europe and South Africa. So I think this is something, and of course not to even talk about India and elsewhere.
The fact is that there are public institutions, there are private institutions, and we all have to work together to make a sustainable healthcare environment. And it is important that the public sector and the public players play their part. And there's a huge opportunity for private capital to actually capitalize and actually support public health goals. But the issue, I think, is how. The issue of blended finance must come to the fore, where we find a way to mix a lot of these types of finance to ensure we actually end up with accessible and affordable healthcare for all.
If you go to Europe or North America, there is no major healthcare institution that does not have the Rockefeller Wing or the Jones Lang Prostate Cancer Center. There is no culture in Nigeria of charitable work towards healthcare, and it's very important, because without that, it all helps to make the venture profitable. Because at the end of the day, if a healthcare facility does not make money, it will run down and will close.
Where there are challenges, there are also opportunities. And when those challenges meet opportunities, there are ways in which these things can be solved. What we know how to do is financing, and we would work with various parties in the industry to ensure that these solutions are brought to bear.
About digitization is to think PPP. One is to select one problem or pain that you're facing. The more acute that pain is, the better it is. Find one technology partner that can help you provide a tech solution, a digital solution to access to improve or solve that problem. And finally, it's not enough to just talk about it, it's to commit to one pilot that will actually enable that solution to start getting used.
Digitization does drive revenue because number one, it helps with efficiency, right? Optimization of processes, which are very key to fundamentals of businesses generally, right? So digitization does definitely help out to increase revenue.
This is the beginning of a great conversation that FSDH has given us in the healthcare sector, an opportunity to really, look at those ways in which we can close the gap. Thank you very much, FSDH, for this opportunity. And please, healthcare guys, we have a lot of work to do, and we must work with the banking team. Thank you.
At FSDH Merchant Bank, we are poised to support all the players across the various verticals of the healthcare space. This includes players in the hospital space, pharmaceutical, supply chain, digital health, HMO, as well as all the emerging trends across the healthcare space. We look forward to doing business and supporting your businesses today and beyond.
We are looking to finance, very ambitious and driven healthcare companies, hospitals, diagnostic centers, pharmaceuticals, retail pharmacies, health medtech space, making sure you have the funding to do what you need to do, the growth you seek to have, the expansion you want to achieve. So if you're looking for a bank to work with, FSDH is home. Come home to FSDH.